Hello, my name is Nicholas Taylor, and today I'm going to talk about issues regarding international development. Much of the world is classified as lacking development. As is seen throughout the world, many countries are well behind reaching the Sustainable Development Goals endorsed by the UN General Assembly. While there are multiple pressing matters in these countries, whether it be social climates or education, for example, I personally believe that one of the most important development goals, aside from eliminating extreme poverty, is the building of a sufficient healthcare system within these nations. In fact, the third sustainable development goal is to achieve good health and well-being. The problem arises when this is not possible, when doctors leave their struggling home countries, when medication facilities do not have running water or electricity, when neglected tropical diseases are running rampant throughout nations, and when overall funding is too low to support the nation. This issue is extremely prevalent among African countries as well as some South Asian countries. Now, healthcare should be a priority by government, although, as said previously, they might just lack the ability to do so. The issue of underdeveloped healthcare systems in different countries greatly affects every single citizen in these countries. Consequences of this issue can include people not going to the hospital to seek care when needed, and only going if it is a matter of life or death. In nations with insufficient healthcare systems, the population regards hospitals as places to die, not to live. As well, there are not enough doctors or nurses to give help to those who need it. And with less doctors, there comes less education about healthcare for the next generation, creating a negative feedback loop. Now, we should care about this issue because, as per the Office of the United Nations High Commissioner for Human Rights and the World Health Organization, everyone has a right to health. Specifically, key aspects of the right to health are entitlements, which include the right to a system of health protection, providing equality of opportunity for everyone to enjoy the highest attainable level of health, the right to prevention, treatment, and control of diseases, access to essential medicines, maternal, child, and reproductive health, equal and timely access to basic health services, the provision of health-related education and information, and the participation of the population in health-related decision-making at the national and community levels. Now, this is a very complicated problem to solve, but thankfully, the World Health Organization has listed 6 health system building blocks: service delivery, health workforce, health information systems, access to essential medicines, financing, and finally, leadership/governance. 3 of which, health workforce, access to essential medicine, and financing, I have already discussed problems about, and coincidentally, are the 3 building blocks that Martin McKee, in his Science Direct article titled Global Sustainable Healthcare, mentions as the most relevant. Firstly, issues regarding health workforce. As mentioned before, many doctors and nurses who grow up in countries lacking development move to better opportunities and higher paying jobs overseas in countries with higher incomes. In order to fix that, we need to educate, train, and raise new generations of doctors and nurses in these nations. In order to do that, here is a potential solution. Vanessa Curie is a part of SEED, a global health nonprofit. While presenting for TEDx Boston, she talks about a program that SEED is completing. The program includes sending dozens of doctors voluntarily to countries with critical situations to train and educate, with goals in mind, including opening a potential pipeline of healthcare education in these countries, of which have little to no medical personnel. This solution, while new and not yet given enough time to see quantifiable data, should hopefully, with additional international support, get rid of any problems regarding health workforce. Secondly, issues regarding access to essential medicines. As mentioned before, neglected tropical diseases are running rampant in countries with critical healthcare situations. In order to fix this, research and development of medicines and vaccines are needed. Currently, medicines are mostly made by pharmaceutical companies seeking profit, which most of the time excludes neglected tropical diseases. Therefore, external funding is needed to support this research. Thankfully, a Kuwait fund and the World Health Organization entered a $4 million agreement to tackle neglected tropical diseases in Africa. This should make a large dent in the issue of access to essential medicines. In fact, we have seen examples of external funding greatly diminishing the occurrence of diseases in countries with critical healthcare situations. An example is the Bill and Melinda Gates Foundation, putting millions into malaria research and almost eradicating the fatal disease. Finally, issues regarding health system financing. As mentioned before, there is often a lack of funding towards healthcare institutions in these countries without development. In order to fix this, there must be enough money collected from everyone, depending on their ability to pay. As well, the receiving of funding should not cost much at all. A solution to this should be a system that already exists in order to lower costs, like taxation. This has already been seen in countries like Canada and France. And while their socioeconomic conditions might differ greatly from these countries in Africa and South Asia, close to the same rate of taxation is apparent in all of the world's healthcare leaders. Healthcare is vital. People need it, and a country cannot call itself developed without the general population being in good health. People cannot excel in the world if they are not healthy. Thank you.